Welcome to the Deep Dive. We're the show that really digs through complex info to find those clear insights, those aha moments you're looking for.
Exactly.
And today we're heading into, well, a fascinating area of health, one that honestly feels surprisingly undiscovered for many people.
It really does.
Our guide is Dr. William Pawluk. He's an MD, MSc, with, get this, 4 decades of clinical practice behind him. And what really hits you, especially reading his big book, Power Tools for Health, is this deep frustration that started his whole journey.
Yeah, you can really feel that.
Imagine, spending your life trying to heal people, ease their suffering, but then you keep hitting the limits of conventional medicine.
Mm-hmm.
Dr. Pawluk talks about seeing patient after patient stuck in these cycles. Chronic pain that just wouldn't quit, depression that fought off every treatment, this awful fatigue sucking the life out of people.
It's heartbreaking.
And he felt this inadequacy, right? Watching them come back, managed maybe, but never really resolved. It was that feeling, that deep dissatisfaction that pushed him to look elsewhere, to find something more fundamental.
Something he calls a hidden yet powerful healing technology.
Exactly. Something he felt he just had to bring out into the open.
And what's so compelling, I think, is that his journey wasn't about just finding an alternative. It wasn't just swapping one thing for another.
Right.
It was about uncovering something foundational, almost, primal, something that supports the body's own ability to heal itself.
That's a huge shift.
It is. He's not selling a magic pill. He's talking about empowering the body right down at the cellular level. It's a totally different way of thinking.
And that different way of thinking, that profound shift, that's our mission for you today, listening in. We are taking a deep dive into Dr. Pawluk's insights, mostly from Power Tools for Health, how pulsed magnetic fields, PEMFs, help you.
Essential reading, really.
It is. And our goal, it's way more than just defining PEMFs. We want you to really get them, understand them, not as some kind of health fad, but as fundamental support.
Right.
For your cells.
Right. For basic cellular function.
It's not about a magic cure for this disease or that condition. It's about understanding how these fields help your body heal itself and how you can use them, these powerful tools, at home as self-care.
Working alongside whatever else you're doing medically.
Precisely. Complementing, not necessarily replacing.
And if we, zoom out for a second, connect this to the bigger picture, that perspective is just critical.
Oh, so?
Well, it shifts the conversation, doesn't it? From just managing symptoms, which, let's be fair, conventional medicine is often very good at, to providing this deep root cause support. It's like giving the body the basic energy, the building blocks it needs to work right. Tapping into its own wisdom, really.
It's inherent wisdom to find balance. I like that. Okay, so think of this deep dive as your shortcut. Your way to get genuinely informed on a topic that, yes, it's complex, but it holds potentially life-changing insights. You're going to get the distilled science, the applications some might surprise you, and the practical, usable takeaways, all curated so you get those aha moments without feeling like you're drowning in data.
Sounds good.
So let's get right into it. Let's unpack this invisible, but potentially incredibly powerful force. Okay, let's start right at the beginning. What exactly are pulsed electromagnetic fields? PEMFs.
Right, the basics.
At the core, they're time-varying magnetic fields delivered in pulses. Now, that phrase, time-varying, that's really the key, isn't it?
Absolutely. It's everything. It means the field isn't constant. It's not like, the magnet holding your shopping list on the fridge.
Okay. Static.
Static, exactly. PEMFs are dynamic. They change over time. On, off, fluctuating strength, changing direction, but in a specific controlled rhythm.
Like a pulse.
Like a pulse. And that pulsed dynamic quality is precisely what gives them their unique biological effects. It's the difference between a photograph and a movie, really.
Good analogy.
And this is truly where it gets really interesting, because that dynamic nature, that's the critical difference between PEMFs and those static magnets.
The ones in jewelry or shoe inserts.
Exactly. You see them marketed for pain relief all the time, but Dr. Pawluk is crystal clear, based on research in his clinical work. Static magnets, their effects are very limited, often just superficial.
Why is that?
Well, they produce a constant field, unchanging. And cells, they tend to adapt to that pretty quickly. The effect just diminishes.
The body gets used to it.
Pretty much. But PEMFs are dynamically changing, so they can penetrate deep into tissues and actively influence cellular signaling in ways static magnets just can't.
Like that rhythmic massage versus constant pressure idea you mentioned.
Exactly that. The active, dynamic interaction with the cells, that's fundamental to their therapeutic power.
Okay, so it's the pulsing that's doing the work, engaging our biology. Now, you also mentioned, crucially, that not all PEMF devices are the same.
Oh, absolutely not. Huge differences.
Dr. Pawluk points out three main variables that differentiate them and really determine their effects. What are those?
Right. So first, you've got frequency. That's how often the pulses are delivered. Think of it like rhythm in music, slow beat, fast beat. Different frequencies resonate differently in the body.
Okay, frequency, what else?
Then there's waveform. That's the actual shape of the pulse. Is it a smooth sine wave, like an ocean wave?
Right.
Or a sharp, sudden square wave? Or maybe a jagged sawtooth? Each shape interacts with cells differently. Subtly, but significantly.
Waveform, got it. And the third?
And finally, intensity. That's just the strength of the magnetic field. How powerful is it?
Okay. Frequency, waveform, intensity. So for you, the listener, understanding these means realizing that, say, a cheap consumer gadget isn't going to pack the same punch as a proper clinical system.
Precisely. It's absolutely not one size fits all. Choosing the right device with the right parameters for your specific goal is crucial.
That raises a really interesting question, though. Why would our bodies even respond to magnetic fields in the first place? We're biological, not electronic, mostly.
Right. Well, if we connect this to the bigger picture, Dr. Pawluk makes a super compelling point about our evolution, our deep connection to the Earth's own magnetic field.
I mean, the planet has a pulse.
In a way, yes. The Earth constantly emits natural PEMFs. The most well-known is the Schumann resonance.
I've heard that term. It sounds a bit mystical.
It sounds evocative, the Earth's heartbeat, but it's real science. It's a set of frequencies in the gap between the Earth's surface and the ionosphere generated by lightning strikes all over the globe.
Wow. A constant background hum.
A subtle but pervasive global pulse. And life, including us, evolved in sync with these fields for millions of years.
Okay, but how does that relate to PEMF therapy now?
Well, think about our modern lives. We're shielded, right? Concrete buildings, steel cars, surrounded by electronics.
We block it out.
We significantly reduce our exposure to these natural foundational fields. Dr. Pawluk argues this creates a kind of deficiency, a disconnection, which impacts our health.
So using therapeutic PEMFs is like reconnecting.
Exactly. It's seen as a way to tap back into a fundamental biological need, restoring a natural energy balance that modern life has kind of messed up.
That's a profound thought. We're designed to sync with the Earth, but we've put ourselves in these insulated boxes.
Pretty much, yeah.
Okay, so let's go from that big environmental idea down to the tiny level. Our cells. How do PEMFs actually work inside us?
Right, the cellular mechanisms. It's fascinating stuff.
So at the micro level, what's happening? One key thing is restoring membrane potential, right?
Absolutely fundamental. Think of a healthy cell like a tiny charged battery. It needs to maintain a specific electrical charge across its membrane, around many of its 70 millivolts.
And that charge is important.
Crucial for almost everything the cell does, getting nutrients in, waste out, communication.
And when cells get sick or damaged?
They lose that charge. They get weak, inefficient, less charged up.
And PEMFs?
They help restore that balance. They literally help recharge the cell, nudging it back towards working properly. It's like giving the battery a jump start.
Okay, recharging the cell. What else?
Building on that, PEMFs also help improve ion flow.
Ions, like calcium, potassium.
Yeah, exactly. Calcium, sodium, potassium, tiny charged particles. Their movement through specific channels in the cell membrane is critical.
For what processes?
Oh, countless things. Nerve impulses firing, muscles contracting, cells talking to each other. It's like the body's internal communication network.
So PEMFs help keep that traffic flowing smoothly.
You got it. They influence those ion channels, helping ensure everything moves correctly. Proper ion exchange is vital for cell health and responsiveness.
Okay, and the energy, I read they affect mitochondria.
Oh yeah, big time. PEMFs act like a turbocharger for the mitochondria, the cell's power plants.
They boost energy production.
They do. They stimulate mitochondria to produce more ADP, adenosine A triphosphate. That's the body's main energy currency.
The fuel for everything?
Everything. DNA repair, muscle movement, thinking, fighting infection. It all runs on ATP. More ATP means better healing, better function, better performance across the board. PEMFs help fill that energy tank.
That sounds foundational. More energy equals better everything.
Pretty much. And there's more. They also help reduce oxidative stress.
Free radicals, that kind of thing.
Exactly. Those unstable molecules that damage our cells contribute to aging, chronic disease. PEMFs help neutralize them, like tiny peacekeepers protecting the cells.
Protecting cells, boosting energy. What else?
Another huge one, they promote nitric oxide release.
Nitric oxide. I know that's important for blood flow.
Critically important. It's a key signaling molecule. When PEMFs trigger its release, one immediate effect is vasodilation, the widening of blood vessels.
Which means better circulation.
Significantly better microcirculation, that's the flow in the tiniest capillaries. Better oxygen delivery, better nutrient delivery to every single cell, and, crucially, better waste removal.
Clearing out the cellular garbage.
Exactly. Like clearing a traffic jam on a vital highway. Everything just works better.
Okay, those are some profound effects at the cellular level. How do these translate to bigger noticeable effects in the body?
Great question. These micro-level changes lead directly to macro-level outcomes, one of the biggest. Reducing inflammation.
Chronic inflammation that's linked to almost everything these days.
It really is. A root cause of so many diseases, a major driver of pain. PEMFs help calm that down by modulating the body's inflammatory responses, like turning down the volume on a faulty alarm.
They also enhance repair, right? Healing.
Massively. Bone, muscle, nerves. PEMFs accelerate the natural healing and regeneration processes. Think of it as giving the body's repair crews a powerful boost.
Faster, more efficient healing.
And more complete recovery. Huge for rehab after injury or surgery.
What about pain itself? Do they just block it?
They do more than block it. They actually modulate pain signaling. They can interrupt and rebalance the nerve signals transmitting pain to the brain, offering direct relief, often without drugs.
Addressing the pathway, not just the symptom.
Exactly. And finally, on this macro level, they can improve brainwave balance.
Brainwaves. Alpha, beta, delta.
Those ones. Our brain activity needs to be balanced for us to function well, think clearly, manage moods, sleep properly. PEMFs can help synchronize brainwaves, guiding them into healthier patterns.
Like tuning an orchestra.
A great way to put it. Bringing the brain back into harmony. Crucial for cognition, mood, and especially sleep quality.
Okay, this all sounds incredibly promising. But is there solid science behind it? Or is it mostly theory and anecdotes?
That's what's fascinating here. It's not just theory. Dr. Pawluk really emphasizes the huge body of evidence. We're talking hundreds of peer-reviewed studies published in proper scientific journals.
Supporting PEMF effectiveness.
Unequivocally, across a wide range of conditions, and maybe even more importantly for credibility, there are significant FDA approvals.
FDA approvals. For what?
For specific PEMF applications, like accelerating bone healing, especially non-union fractures bones that just won't heal on their own.
Wow.
And also for certain types of treatment-resistant depression. These aren't fringe applications. This is established medical credibility, regulatory acceptance.
That's a big deal.
Yeah.
So what kinds of conditions does the evidence support using PEMS for?
The list is impressively long. Things like chronic pain syndromes, arthritis pain and stiffness, nerve pain, that stubborn back pain so many people have.
Type pain. What else?
Mental health conditions. We mentioned treatment-resistant depression, but also anxiety, PTSD, bone and joint issues beyond fractures, osteoporosis, general arthritis management.
Sleep.
Definitely sleep disturbances, insomnia, just poor quality sleep. Also, chronic inflammation disorders, which often underlies autoimmune conditions.
Neurological.
Growing evidence there, too. Brain injuries like concussion recovery and potentially offering support in neurodegenerative conditions like Parkinson's or MS. It's really broad.
That broadness makes you wonder, what's the core idea here? How can one thing help so many different issues?
Right. It raises that important question. And connecting this to the bigger picture, Dr. Pawluk's central idea is elegant. PEMFs don't treat diseases directly, like a drug targets a specific bug or symptom.
Okay, so what do they do?
They work more fundamentally. They restore cellular energy and balance. By doing that, they make the body itself inherently better at healing and managing all sorts of conditions.
So you're supporting the body's own systems.
Exactly. It aligns with a more holistic view. Foundational support, optimizing resilience rather than just chasing symptoms. For you, the listener, it's a more empowering way to think about therapy, giving your biology the tools it needs to thrive.
Okay, let's unpack this even more. Let's talk specific, real-world health benefits, starting with something huge, pain management.
A major area, definitely.
How do PEMFs turn down the volume on pain? You mentioned a few ways.
Right. It's multifaceted. First, they reduce that underlying inflammation, which is so often a driver of chronic pain.
Makes sense.
They also help relax muscles and joints, easing that tension and stiffness that contributes to pain.
Okay.
And critically, they directly interact with nerve signals, interrupting and rebalancing the pain messages going to the brain. It's a comprehensive approach.
So where's this applied? What kinds of pain?
The applications are really diverse. Huge benefits seen in arthritis, reducing stiffness, swelling, discomfort.
Osteoarthritis, rheumatoid.
Both, potentially by addressing the inflammation and supporting joint tissue. Also, conditions like fibromyalgia with its widespread pain and fatigue. PEMFs seem to help with the neurological and inflammatory aspects.
What about headaches? Migraines?
Yes, reports show they can reduce the frequency and intensity of migraines, and they're very useful for post-surgical pain, helping speed recovery and potentially reducing the need for strong painkillers.
That's significant.
It is.
In Dr. Pawluk's book, it has stories, right? Case studies.
Absolutely. Really powerful ones. People with years of chronic back pain who tried everything.
Finding real relief.
Significant, lasting relief after consistent daily PEMF use. There's one story about a construction worker, Mark, with decade-long back pain after an injury. Nothing worked long-term.
Until PEMFs.
After using a PEMF mat daily for weeks, he wasn't just in less pain. He could do light work again, play with his grandkids, things he thought were gone forever. These stories show the potential impact on quality of life.
That's incredible. Okay, moving to bone and joint health. You mentioned FDA approval here.
Yes, and here's where it gets really interesting regarding credibility. PEMFs are FDA approved specifically for non-union fractures.
Meaning bones that haven't healed properly.
Exactly. When a fracture just refuses to mend after months, PEMF therapy is officially recognized as a legitimate, effective medical treatment in those cases.
That speaks volumes.
It really does. It moves it way beyond speculation. It's proven.
And how does it work? Why does it help bones heal?
The mechanisms are well understood. PEMFs directly stimulate osteoblasts. Those are the cells that build new bone.
They supercharge the bone-building cells.
Basically, yes. They also increase mineralization, helping deposit calcium and other minerals into the bone matrix, making it strong.
So it speeds up the whole process.
Significantly accelerates fracture healing, leads to stronger, faster, more complete recovery, like giving the bone repair crew a boost and better tools.
Beyond fractures, any other bone benefits? Osteoporosis, arthritis.
Definitely. For osteoporosis, where bones become brittle, PEMFs can help improve bone density, which is key for preventing fractures.
And arthritis.
For arthritis, they help protect existing cartilage and reduce that joint inflammation, which eases pain and improves function. So useful for prevention and management.
Makes sense. And you see this used in rehab settings.
Increasingly common in orthopedic rehab. After knee replacements, complex injuries, PEMFs are integrated to help patients recover faster and more fully, get them moving again sooner.
Okay, let's shift to the brain. Mental health. This sounds like a really cutting-edge area for PEMFs.
It is. And showing remarkable promise. For instance, specific devices are FDA cleared for treatment-resistant depression.
That's huge for people who haven't responded to anything else.
Exactly. Where drugs, therapy, everything else has failed. It offers real hope in those very difficult situations. A non-invasive, drug-free approach to rebalancing the brain.
How does it work in the brain? What are the mechanisms?
It's complex. PEMFs seem to increase blood flow to specific brain regions that might be underactive.
Delivering more oxygen and nutrients?
Right. They also enhance neuroplasticity, the brain's amazing ability to reorganize itself, form new connections, adapt.
Helping the brain rewire itself.
In a positive way. And they help balance neurotransmitters, serotonin, dopamine, those key chemical messengers crucial for mood, focus, well-being. Optimizing those can have a big impact.
And it's not just severe depression, right? Other applications.
Many others showing promise. Anxiety, PTSD, helping calm overactive pathways, process trauma, insomnia, which we'll touch on more, even potentially focus issues in ADHD, and importantly, concussion recovery.
Helping repair the brain after injury.
Assisting neural repair, restoring cognitive function. It's a powerful tool for helping the brain heal and rebalance across many conditions.
You mentioned sleep specifically. How do PEMFs help with insomnia?
Studies show they really improve sleep quality and regulate REM sleep. It works through something called brainwave entrainment.
Entrainment, like guiding the brainwaves.
Exactly. Gently guiding brain activity from, say, an anxious beta state towards calmer alpha or deeper delta states needed for restorative sleep.
So it helps you fall asleep and stay asleep.
And improves the quality of that sleep, optimizing those crucial sleep cycles. For anyone struggling with sleep, that can be absolutely life-changing.
What's fascinating here is the connection to circulation and cardiovascular support. How do PEMFs help there?
Primarily by boosting microcirculation. Remember, that's blood flow in the tiniest vessels, the capillary.
Which make up most of our circulatory system.
90% of it. PEMFs enhance this flow, mainly through releasing nitric oxide, causing vasodilation.
Widening those tiny vessels. Why is that so vital?
Because that's where the action happens, where oxygen, nutrients, hormones get delivered to every single cell, and where waste products get picked up. If microcirculation is bad, everything suffers.
So improving it helps. Well, everything.
Pretty much. Think about hypertension. Better microcirculation can help regulate blood pressure. Poor wound healing. Optimized blood flow brings in all the healing factors needed.
Makes wounds heal faster.
Exactly. And conditions like peripheral artery disease, PAD, where limb blood flow is restricted, PEMFs can offer relief by improving capillary function.
What about diabetes? That often involves circulation problems.
Huge implications there. Diabetics often suffer from complications due to poor blood flow, foot ulcers, neuropathy.
Nerve damage.
Right. PEMFs might help prevent these by restoring that critical capillary flow, improving tissue health, nerve function, and the body's ability to heal. A proactive tool for managing long-term effects.
Okay, let's connect this to the bigger picture. Inflammation and the immune system. How do PEMFs fit in?
They have a potent anti-inflammatory action. They actually downregulate specific pro-inflammatory cytokines.
Cytokines, those are signaling molecules.
Chemical messengers, yeah. Think of inflammation as a fire. Certain cytokines like IL-1 and TNF-alpha are like shouting, "Add more fuel!"
And PEMFs quiet them down.
They help quiet those signals, calming the fire, preventing chronic inflammation from causing widespread damage.
Do they affect the immune system directly too?
They seem to subtly enhance immune cell signaling, helping immune cells communicate better, respond more effectively and quickly.
So potentially faster recovery from infections.
Potentially by optimizing the body's natural defense coordination, boosting overall immune resilience.
And for autoimmune conditions where the immune system attacks itself.
Important clarification here, PEMFs aren't a cure, but they can be very helpful in moderating that overactive inflammatory response that drives those conditions.
So managing symptoms, reducing the attack.
Exactly. A tool for management, symptom reduction, helping bring the body back towards balance, alleviating suffering.
This naturally brings up some really challenging conditions. Neurological and neurodegenerative diseases. Can PEMFs help there?
It's an area of intense interest and growing application. Conditions like multiple sclerosis, MS, Parkinson's, even stroke recovery.
Where nerve damage is central.
Precisely. Areas where conventional medicine often has limited options for actual repair.
What are the repair mechanisms PEMFs might trigger?
They're specific and quite hopeful. In MS, for example, studies suggest PEMFs can promote remyelination, repairing the damaged myelin sheath that protects nerve fibers.
That's incredible, rebuilding the insulation.
Potentially, yes. They also seem to encourage general nerve repair after injury and even stimulate neurogenesis, the growth of new brain cells.
New brain cells, really. It's a fascinating area of research. All these actions contribute to improving brain function, connectivity, potentially mitigating the effects of these conditions.
Can you give an example, like with stroke?
Yes, stroke recovery is a great example. Research shows that when PEMFs are used alongside traditional rehab exercises, physical therapy, occupational therapy.
Right. Combining them significantly improves motor recovery in stroke patients. It's a synergistic effect. The PEMF seems to create a better environment for the brain to heal and reorganize during therapy,
leading to better functional outcomes.
Exactly. Greater independence.
Okay, let's unpack this idea of whole body wellness.
Yeah.
Moving beyond just fixing problems to actually optimizing health. Anti-aging.
Yes, PEMFs contribute to anti-aging effects in several ways. Boosting ATP means more cellular energy, faster recovery from fatigue, more vitality.
Handling younger, basically.
And by reducing that oxidative stress, they protect cells from age-related damage. It's like slowing down the cellular clock at a fundamental level.
What about for athletes? Sports performance.
Big benefits there. Faster recovery times, reduced muscle soreness, that DOMS effect.
Late onset muscle soreness. Dreaded.
Right. PEMFs help reduce that. Also, potential improvements in stamina and endurance, all due to better cellular efficiency, oxygen delivery, waste removal.
So you can train harder, recover faster.
And perform better, potentially with less risk of injury, like having a cellular pit crew.
And detoxification, how does that fit in?
Well, PEMFs don't directly detox in the way some fads claim, but the improved microcirculation is key.
Better blood flow helps clear waste.
Absolutely. More efficient removal of metabolic waste from cells and tissues. This supports the liver and kidneys in their natural detox processes, reduces the body's overall toxic load.
Okay, this is where it gets really interesting for people listening. Practical application. How do you actually use PEMFs? And how do you choose the device? It seems complicated.
It can feel overwhelming, yeah, because there are critical differences. We touched on intensity, low intensity for general wellness, high intensity for deeper targeted issues.
Right.
Then the waveform, sawtooth, square, sine wave, each interacts differently with cells. Frequency is key. Two low frequencies often mimic Earth's resonance for restoration, higher frequencies for other specific outcomes.
And the applicator. Mats, coils?
Exactly.
Okay.
Big mats for whole body treatment, smaller coils for localized problems like a specific joint, or even the head.
So for you, the listener, the takeaway is, it's definitely not one size fits all.
Absolutely not. Choosing a device critically depends on your specific condition, your budget, your health goals. A device for, say, sleep might be very different from one for a non-union fracture.
So research is needed, maybe consultation.
Highly recommended. Talk to a knowledgeable practitioner or do thorough research to find a system that genuinely matches your needs.
And once you have a device, how do you use it best? Dr. Pawluk gives guidance on this, right?
Very practical advice. Number 1, consistency. Daily use is far more important for long-term benefits than hitting it hard occasionally.
Cumulative effect.
Exactly. Gentle, consistent nudging back to balance. Second, start slow. Lower intensity, shorter durations initially, gradually increase as your body adapts.
Don't overwhelm the system.
Right. And regarding safety, he's very reassuring. Side effects are minimal. Some might feel a bit tired initially, maybe some mild detox-like symptoms as things shift.
But generally safe.
Extremely safe, especially when used as directed. These temporary adjustment symptoms usually pass quickly.
So what does all this mean for integrating PEMFs into your life? Can you use them with other things you're doing for health?
Definitely. Dr. Pawluk strongly advocates a holistic approach. PEMFs work synergistically, meaning they enhance other practices.
Like with nutrition.
Yes. Better cell function and circulation mean better nutrient absorption. Your body makes better use of healthy food, faster repair.
And exercise or physical therapy.
Big synergy there. PEMFs accelerate recovery from exercise, reduce soreness, makes physical therapy more effective, speeds up injury rehab.
What about stress management, meditation, yoga?
Can deepen relaxation. By helping balance brain waves and calm the nervous system, they enhance the effects of mindfulness practices.
And medications. Any interaction.
This needs caution. In some cases, because PEMFs improve overall function and healing, the need for certain medications might reduce over time, but
The ET. Under medical supervision only.
absolutely critical. Never change medications on your own. The philosophy is integration PEMFs are a supportive tool within a broader strategy, not a replacement for necessary medical care or healthy habits.
Okay. What's fascinating here, again, are those real-world stories. The case studies really drive it home.
They really do. They show the diverse impact. Like the elderly woman, Eleanor, crippled by arthritis pain.
Finding she could garden again.
Exactly. Regaining mobility, reducing pain significantly after consistent use, getting back a passion she thought was lost forever. It's about quality of life changes.
You mentioned a veteran with PTSD and insomnia, too?
Yes, finding profound relief. Sleeping better, yes, but also less anxiety, fewer flashbacks, shows the power to rebalance brain function and improve mental well-being dramatically.
And the diabetic patient with a non-healing wound.
David. Wounds stalled for months, defying conventional care. Consistent PEMF use improves circulation and tissue repair enough for them to finally heal. Demonstrates that fundamental impact on blood flow and cellular healing.
So while results vary, the common thread seems to be
Consistent, committed, often long-term use, leading to profound, lasting changes. It's not an overnight fix, but a deep, foundational shift.
which naturally raises that important question again. If it's so effective, why isn't this mainstream? Why haven't I heard more about it?
The barriers. Dr. Pawluk addresses this head-on, a big one. The lack of a pharmaceutical profit motive.
No big drug company patents.
Exactly. PEMF devices aren't patentable drugs generating billions, so less incentive for big pharma to fund massive research trials and marketing blitzes.
That makes sense, unfortunately. What else?
Slow regulatory acceptance. Getting new medical devices approved, especially ones that don't fit old categories, is a long, complex, incredibly expensive process.
Bureaucracy and costs.
Huge hurdles. Then there's simple physician ignorance. It's not taught in most medical schools.
So doctors just don't know about it.
Largely, yes. If they don't learn about it, they can't recommend it. Leads to a lack of awareness among practitioners.
And the public.
Often public skepticism. Because it's not mainstream medicine, it sometimes gets unfairly lumped with unproven alternative stuff, despite the solid science and FDA approvals.
Guilt by association.
Unfortunately. So Dr. Pawluk's argument is forceful. The evidence base is strong and growing. The main barrier isn't lack of science. It's lack of awareness and education, both in the medical world and for the public.
Breaking through that knowledge gap.
That's the challenge, changing the paradigm. #tag conclusion.
So, bringing this all together, this deep dive, Dr. Pawluk really positions PEMFs as incredibly versatile, safe, and just massively underutilized tools for health today.
Foundational tool.
He calls it foundational energy medicine, not just treating symptoms, but restoring that core cellular vitality, that balance, so the body can essentially heal itself better.
Empowering our own biology.
Exactly, empowering biology from the ground up.
And what's really fascinating, almost visionary, is his prediction for the future.
What does he see happening?
He really envisions PEMF devices becoming common household appliances, like as normal as having a blood pressure cuff or a humidifier.
Part of our daily routine for prevention and restoration.
Seamlessly integrated, just part of how we proactively manage wellness at home.
Yeah.
Personalized, accessible health tech.
It's a compelling vision. And it leads right into his final message, doesn't it? The empowerment piece.
Absolutely. His ultimate message for you, the listener, is powerful. You are responsible for your health. PEMFs give you a tool to reclaim it.
It really puts the agency back with the individual. Here's the knowledge, here's a tool, take charge.
Exactly. It's about understanding your body's potential and how to support it. #outro. And that really wraps up our deep dive into Dr. William Pawluk's Power Tools for Health. We've covered a lot of ground, the science behind PEMFs, the mechanisms.
The how and why.
The incredibly diverse benefits across so many conditions, the practicalities of using them, and even why they're not yet as mainstream as the evidence suggests they should be.
We hope this journey through his work has given you a really solid, comprehensive understanding, all drawn from his expertise and clinical experience.
Yeah, distilled insights, hopefully.
Absolutely.
Yeah.
And as you go on with your day, we want to leave you with maybe one last provocative thought to consider.
Okay.
Think about this. Our bodies evolved over millions of years, perfectly in tune with the Earth's subtle, natural magnetic fields.
Right, that connection we discussed.
And our modern lives, all the tech, the buildings, have increasingly shielded us from those energies. So the question is, how might actively reconnecting with these fundamental biological inputs, how might that reshape our whole understanding of preventative health?
And our personal responsibility in managing it?
Exactly.
Yeah.
Especially in this increasingly technological and maybe energetically disconnected world. Something to mull over.
Definitely food for thought.
Thank you for joining us on The Deep Dive.